Um, Basically, I think I was overworking. I was running two practices at a time, two chiropractic offices, adjusting full spine manual, which just means it was very demanding physically. And I was having about 50 patient contact hours a week, which is really a heavy load, too heavy. And I was on a canoe trip, very simple canoe trip, and I was helping portage, and I felt something go in my back doing a normal portage, and
Portage is about how much weight?
it wouldn't have been more than 40 or 50 pounds. So no awkward lift. It's just something felt bad, and within 2 days I started to have debilitating pain down my leg, and I worked for another month, and it just got worse and worse to the point where I couldn't walk. And I spent 5.5 months on the floor, just narrowly avoiding surgery, two very large disc herniations.
And when was this?
1998, so 15 years ago.
And were you training in any way at that time?
I was always a runner and was pursuing a little bit of biking and not a really good swimmer. Um, and during the course of being injured, it was very frustrating because I once I could start walking again, and after 6 months I started practicing again my profession, and I could do nothing. I couldn't walk, I couldn't run, I couldn't bike, and I could swim about 50 meters to 100 meters, and I would do that 3 times a week. I'd go get adjusted, narrowly avoided surgery, and I was at a conference about a year and a half later. I'd gained about 25 pounds.
Up to what?
Oh, I was about 190 at that point, 6 foot 2.5, and I sat on a Concept 2 rowing ergometer, and I spent 5 minutes on that, and for the first time I could sit comfortably for more than 20 minutes at a time.
And how did it happen? What drew you to sit on a Concept 2 rowing
I
ergometer?
had sat on a Model A, the very first one at university when I was in university in Nova Scotia.
Years before?
Yeah, years and years before. It was 1982 probably, and I just sat on it. I thought maybe that would be a good idea just to loosen me up. And I was very upright rowing, and I just moved back and forth very gently for 5 minutes, and I could sit comfortably for the first time, for a little while anyway. The next
You mean after you got off it?
Yeah, for for 24 hours I slept better. I was actually able to sleep, and then the next day I sat on it for 10 minutes, going back and forth very easily.
And how long after your injury was this?
This was almost 18 months,
Eh,
almost 2 years, really.
And you were still having symptoms?
Oh yeah, I was every day in practice was, am I going to be in surgery next week? I just was waiting for the
So did the symptoms include back pain and sciatica?
back pain, leg pain. I had lost 30% of the muscle mass in the back of my thigh and my buttock, and
Oh my gosh.
I didn't know where my right leg was. Much of the time there was a lot of proprioceptive loss. Position sense was gone. And so the third day of this conference, I rode for 15 minutes, and it was the most physical activity I'd done in over 2 years. And I really, I love physical activity. I mean, it's part of the joy of being a chiropractor. I don't have to sit behind a desk or anything. And I got off after the 15 minutes. The rest of the conference was very comfortable. I could sit and actually listen to the speakers, and it was marvelous. And I went home and I ordered a Concept 2, and I got it from my office, and I put it in the basement of my building, and I rode every day, and I worked up to 30 or 40 minutes, and it got to the point where my back pain left completely, and within about 8 months, my leg was almost the same size again. I had restored the muscle mass.
How much were you rowing?
Probably 10 Ks at a time, 8 to 10 Ks at a time.
And were you mindful of any particular style or technique?
I was very, very trepidatious at first. I would row pretty much with my back like this, go back and forward. And then I started to put a little forward and back lean, and I was really conscious of supporting my back. And so when I started, this is jumping ahead, but when I started on the water, I was accused of having a very rigid posture. And it was all about protecting my back at that point and trying to find a way, because at that point I had started to compete indoor rowing, and within, I think, less than 18 months of getting on the ergometer the first time, it may have been only a year, I went to the Canadian rowing championships, and I won the heavyweight championships, and I was only about 100 and this was the indoor championship, 180 pounds.
You won the heavyweight
Yeah,
concept to
in the Canadian championship.
nationwide.
Yeah,
What was your time?
it was about 6:30, I think, at that point.
In summary, from when you were injured in 98
Eight.
to when you got the erg, that was about a year and a half.
About a year and a half. So the injury was in the summer fall of 98, late summer of 98, and by 18 months later I'd gotten back to work after 6 months off. Every day was wondering whether the hammer would fall again and I would be in the surgical suite getting discs removed or what have you, and then I get the ergometer about 18 months later and I could start to do activity again. I still couldn't run. That seemed to set my back off. I think there was a lot of weakness developed after 18 months, but the rowing started to stabilize my back and my core so much that I was able to work very comfortably.
And this is documented by MRI.
Documented by two disc herniations, L45, L5S1, two MRIs. The next one, the second one was significantly worse than the first one. Then the first MRI, it progressed. There was more extrusion of the disc into the spinal canal. But at that point, I had started to be able to stand and walk a little bit. Before even 10 steps was it. And so the surgeon was very reluctant. He said, well, you're making some progress. Let's wait another 3 months. And during that next 3 months, I was able to get back to work. I modified things so I didn't have to walk too far between rooms. We scheduled it so every 15 minutes I would take a 5-minute pause between patients and lie down. And I was just getting a little better, but it sort of plateaued. I was still very busy in practice. I couldn't find anybody to help me run the practice. So I kept going and thinking, I don't know if this is going to work. And then about a year after getting back to work, and it was about a year and a half after getting back to work, I was at a conference. I felt very good rowing for just a little bit on the Concept 2 machine. And then I bought one after that conference and worked my way up to within a year competing at the Canadian Indoor Rowing Championships. But having a very stiff, I guess, and not a great reach, in a terrible layback, I guess you would say, if we could ever see video of that time. But it was so joyous to me to be able to be active and to be competitive at something again that it was great for me. And I just kept getting stronger and stronger. And then I started to get some coaching on the water in Ottawa, which didn't work out so well. It was a difference of personalities. And then I came down here about 10 years ago to Craftsbury and started to really learn how to scull. And during that time, I've used the rowing machine probably a minimum of 3 or 4 times a week. Even at this point in the last 7 years, my wife and I have done a lot of Ironman triathlons. So it's enabled me to get back to that activity. But I still row, even if it's for 20 or 30 minutes, just as a stabilizer for my back. It is the thing that keeps me at work. There's no question about it.
And as a chiropractor, had you ever seen rowers come in asking for treatment after a rowing-related back pain?
I live in a very rural area with great rowing water, but no rowers. There's virtually nobody at that point. Now there are a couple of rowers that moved to the area, but no, I'd never seen anybody with rowing injuries. All I'd known for myself was this thing worked like a charm, to the point where currently I have 10 rowing machines in the basement. We've created a gym, and we teach people how to exercise. And they're all practice members, so they're all people who, 80% of them are there, who have back issues. I mean, they really have back issues, and it's just been an amazing process to take people from inactivity, and some of them who've always been sedentary, to introduce them to activity as a way to core strengthen, manage weight, and just enjoy activity, which they've never done before.
So part of your success is not being predisposed to think of rowing as something that's harmful for your back or hard on your back.
And I hear this, John, like you've said, rowing is bad for, people will say, oh, rowing's bad for your back. I have patients come and say, they asked me to get off the rowing machine at the gym because rowing is bad for my back. Why are you asking me to row? And I say, well, let me tell you my story if they don't know my story. And I say, you know what, for me, if I wasn't rowing, I wouldn't be working.
So you discovered that the erg helped your back, and now you're hearing people talk about rowing as being hard on backs, and yet you've used it to not only win the Canadian indoor erg uh, competition, but you use it for therapy for back pain and encourage other patients to use it. How do you, as a chiropractor and as an athlete, how do you do this? And you're sort of bucking the trend, bucking the.
Yeah.
How do you do it?
I think with taking people who are sedentary, not active very much, it's an interesting thing on the rowing machine because people can't sit for more than 5 minutes. They get a sore butt. It's really, so we've created a program that's really quite simple. We row for 5 or 10 minutes at a very sedate pace and get up and down and do core exercises. But how we get people to row and the technique is very, very simple. It's all about body position and what's the strongest for their back. Being all hunched over and curved and then trying to load that up is a mistake. You know, if you look at a bodybuilder, if you look at someone who plays on the line, if you look at someone who rides a horse, they're not hunched over. They're strongest with their back in a slight extension, sitting up nice and tall. And if we can get rowers to do that, they're never going to hurt their backs. They are never going to hurt their backs.
So you're conscious of almost positioning your back with a curve in on the small of the back instead of out.
Yeah, as much as can be. That's for when you're getting into the competition. Yes, you're going to want a little extra reach on the rowing ergometer. Although I would argue that erging and rowing on the water, sculling on the water, there's some differences with that for sure. But the mechanics are very simple, I think, to safeguard your back. When we're younger, we can do anything for a long time. We can get away with murder, slumping in our seats, doing all this stuff. But as we age, our tissues do not heal up as quickly. And wouldn't it be nice if we all had good postural habits from the time we're young, and teaching our young athletes to do that as well? But I think for me, the only way I can row and row successfully is because I'm using my back in the strongest possible way. Because it is damaged. I'm damaged good in that sense. I know the two discs are not as strong as they can be. Even back in '98, there was some degenerative disc change and degenerative joint disease as well, some arthritic change. But it's, that's not a disability. It's just something we work with, and by safeguarding the back in the strongest possible fashion, that becomes a non-issue, I think.
And what do you say to someone who says, "Oh, but I saw Olaf Tufte race in the World Championships in the final, and he's pretty fast, and he doesn't row with a straight back." Or the West German woman from 2004 didn't look like she had a very straight back.
Good point, and they do really well. And I think if we put Olaf Tufte on a horse and asked him to do some jumps, he would pretty quickly change his posture because he couldn't do that. And if we asked him to do a maximal lift, I bet he'd stick his butt out, put a curve in his back to lift something up off the ground. So I think if that's our maximal strength, maybe we should be working from that. I'm not going to tell Olaf Tufte I can help him row faster, but I just think to safeguard his back, he could be doing something different, and he may well in other maximal lift things.
Has it come to make sense to you from all the science you know from your work in chiropractic, how a straight back posture or can be better, or a curved back posture in rowing can be worse?
Well, there's definitely different stresses on the discs. When you're flexed forward at the waist with a curved back, you have immense pressures pushing that intradiscal material, the soft jelly part, back against the back of the disc. And if there's any weakness that is developed in there, which can happen asymptomatically with no symptoms, you can have acute failure. I mean, you certainly can. There's definitely been, these things have happened to people, I've seen a YouTube video of a guy at the World Championships who had an acute disc herniation, and he was, and I'm not saying it's the only way it can happen, but he was definitely a rounded back rower. But I guess it could happen to anybody. I mean, it happened to me lifting a canoe, but I think if you have progressive wear and tear, you lead yourself to more risk of injury if you're not having proper biomechanics.
So you've come to believe that a curved back rowing posture, especially at the catch, is going to be a higher risk for back injuries.
Yeah, I think a lot of times and it may not show up for years.
Yep.
But I think it's not the strongest position in your back.
Is there any disadvantage from rowing with is it fair to call your style of rowing a straight back technique, or what would you call it?
I really don't know. I don't get a lot of coaching. I get no coaching where I am. I come down to Craftsbury once a year at best, and I get some coaching here. So I do have a fairly upright posture. I have quite long limbs and legs, so maybe I can get away with that. But I'm still got some forward lean with my compression, some layback. So it's not completely straight back. It's just I'm very conscious at the catch, especially when the load is very high, to stabilize, make sure my back is fairly neutral position. And then I think if we looked at my force curve profile, we might see that I'm a little lighter on my catch, and try and bring the strength on at the middle of the stroke when I'm definitely most protected.
Do you feel like the coaches here at Craftsbury are tolerating you and working with you and saying, oh, he's different, we'll let him row his way because he's had such a back injury? Or do you not get that impression here?
I don't get that impression at all. I get the impression that they don't want to come down hard on someone who has a particularly, curved back because of their, good flexibility. But I think they're very conscious of trying to help people find the strongest, safest way to do this. And I don't think they're going out of their way. I mean, I have come here in the past and had one of the coaches say, would you just lighten up a little bit, Kevin? You're too stiff. And that's okay too. It's just, I explained that I've had back injuries before, and I'm being very conscious of my effort as I go through the stroke.
And you won the World Championships indoor in Canada for Concept 2.
I won the Canadian indoor championships.
Canadian.
This past year, I came in second at the World Championships.
And to be that good and that successful, your straight back rowing can't be that.
It's not
much of a disadvantage.
I don't think that's any disadvantage.
What allows you to compete at such a high level? Is it because you've been in training for so many years before that?
I think so. I think being in shape. I like the activity, so I do it. This past year, I averaged 60 to 80 or more kilometers a week on the indoor rowing machine. I'm able to row as a lightweight at 6'2.5", so I'm maximizing what little I have. I mean, as a heavyweight, even though I can race in Canada and do well as a heavyweight, when I get to the World Championships, it's hard to race against someone who's 260 pounds.
Would you ever consider coming down to the Boston World Championships for indoor in February?
I did last year. I came in second.
Oh, you came to Boston?
Yes, I came in second.
Aha. For your age group in lightweight, in your weight group.
50 to 55, yeah. Yeah.